A 3-year-old girl is brought to the pediatric clinic by her parents who report that she has had a noisy and difficult breathing since she was an infant. Recently, her breathing sounds have worsened and are now accompanied by a barking cough. Physical examination reveals a monophonic wheeze and stridor that worsens with crying. The patient appears mildly distressed during the examination, especially on inspiration. Considering the ongoing symptoms and presentation, what would be a likely initial diagnostic approach to identify the underlying cause? A. Pulmonary function test. B. Chest X-ray. C. High-resolution imaging or bronchoscopy. D. Allergy testing. The correct answer is C. High-resolution imaging and bronchoscopy are crucial for direct visualization and diagnosis of intrinsic obstructions in the trachea, such as hemangiomas, hamartomas, or tracheal webs. These conditions cause narrowing of the tracheal lumen leading to stridor and wheezing, which mimics asthma but stems from physical obstruction rather than bronchial reactivity. Bronchoscopy, in particular, will allow for both diagnosis and assessment of the extent of tracheal narrowing, which correlates with the severity of symptoms ranging from respiratory distress to stridor that could be inspiratory or expiratory. Thank you for joining this pediatric case study. This session provided insights into diagnosing pediatric airway obstructions and emphasized the importance of using high-resolution imaging and bronchoscopy in cases of stridor and wheezing, ensuring accurate diagnosis and appropriate management.